The clinical experience is one of the main strengths of this program. The amount of surgical experience that we get from day one is rich, appropriate. We get to see the bread and butter with the amount and the volume that we see, and being a referral source for a very wide radius. We also get to see a lot of the more rare pathology that will allow us to understand, to be able to treat people better in the future.
We do have 3 different clinical sites here in Madison. University Hospital is the main, big university affiliated hospital, and the residents go there for predominantly their oncology experience. And then Meriter Hospital is a partner hospital, and that's where most of the obstetrics and benign gynecology experiences happen. And then St. Mary's really shows what a community practice type setting is.
I think it benefits us to work at 3 different hospitals. We get to see differences in practice everywhere that we go, and just sort of the small changes between hospital systems. Even between Meriter and UW, there are changes between how the ORs work and how things are done that can help us prepare to transition to different places after we leave here.
We have our resident continuity clinic, which we function as the primary providers for patients, which is a really good opportunity for us to really kind of take control and ownership of our patients, as well as doing that an environment where it's safe and we have support from a faculty member.
At the resident continuity clinic, they see a mix of OB and GYN patients, and really a wide breadth and depth of simple visits to really complex visits. When you come out as a faculty or as an attending physician, so much of your job is outpatient medicine, and so I feel like their experience at the resident continuity clinic really prepares them well for that. So each PGY4 resident will spend 2 clinical blocks at the resident clinic functioning as sort of the manager of the clinic. They manage the in-basket, including patient phone calls, my chart messages, results, and they really learned the nuts and bolts of how do you coordinate patient care, which aside from just seeing patients face-to-face in clinic is really an important skill set to develop and learn when you do go out and practice on your own. And in talking with residents who've graduated previously, they said that has been such a helpful experience for them as they have gone out into their own clinics.
As an intern, we get the chance to rotate on a lot of different specialties, which is an awesome experience to really transition into residency and also get that early exposure to subspecialties if you are interested in potentially pursuing a fellowship later on in your career.
We do a lot of gynecology, oncology in the first few years and throughout the entire time that we're here at UW. Which is really nice, learning how to take care of patients with gynecological cancers. And then also we get exposure a lot throughout our second year of training, working with the MFM doctors taking care of more high-risk pregnancies. We're kind of changing our curriculum now to get more exposure to REI within the first year of training, as well as the second year. So it's nice for people to kind of learn how to take care of people with reproductive endocrinology cases and infertility and working up those diagnoses. During our 3rd year, we get exposure to urogynecology, and we have 8 weeks of uninterrupted time doing that.
We have family planning as part of the rotations in 1st, 2nd, and 3rd year. And those rotations can be at Planned Parenthood here in Wisconsin, also at clinics here throughout the Madison area.
We established a partnership with an institution in Illinois where we are now sending our residents, or where we started to send our residents for an out-of-state rotation, and we are continuing to do that even though abortion access has come back to Wisconsin in the last year. The out-of-state rotation gives our residents another experience in what it would be like to provide that care in a very different setting. So I think our residents have been really thrilled with their experiences there. They've felt very welcomed by the faculty and the residents at the other institution.
We have call pools that are different for every rotation. We do 24-hour call, like every once in a while. Usually we try not to have the interns do 24-hour call just to kind of help ease them into residency and that busy schedule. We cover call at all 3 hospitals, St. Mary's, Meriter, and the University Hospital. And so we do have to be available for those different call pools. But usually we average about 1 to 2 golden weekends a month, which I think is pretty on par for other OB residencies.
Trainees get, I think, a really high-level surgical training here, so they leave feeling generally comfortable that they can do surgeries on their own. Yes, of course, they could pursue subspecialty fellowship training if they want, but it is absolutely not a requirement when you graduate from our program because people feel so comfortable once they get the surgical training here.
I think residents really benefit at UW from the high clinical volume. It means it's a lot of work and they spend a lot of time working, but the trade-off and benefit is that they become really competent in a lot of the important clinical care that prepares them well for practice after graduation.